Hey, it's Dr. Brian Mowll, the diabetes coach. I am a master licensed diabetes educator, certified diabetes care and education specialist, and IFM certified in functional medicine. I specialize in helping people with insulin resistance, type 2 diabetes, and metabolic dysfunction to find and fix, to address the underlying root causes of their problems in order to reverse those conditions. And today we're going to be talking about confusing diabetes terms. We've often heard things like type 1.5 diabetes, LADA, double diabetes, type 3 diabetes, and a few others, which can be really confusing. So I'm going to talk about those, explain what each of those is, as well as clear up type 1 and type 2 diabetes so you understand those as well. So type 1.5, type 2, double diabetes, type 3 diabetes. What are these, and is it important for you to understand them, and are they relevant to you? Before I get into this video completely, I just want to ask you, if you like my content, please subscribe to the channel and click that bell for notifications. That way you'll know whenever I release a new video, including my podcast episodes, as well as these weekly videos. And if you like this video in particular, give it a thumbs up and put a comment below. Let me know if you find this information helpful and if you have any other questions that I can answer for you in a future video just like this one. Also, if you want more information about how to find and address the underlying root causes of metabolic dysfunction and diabetes, I have a free guide that you can get if you look in the description below this video called the Blood Sugar Manifesto. I just rewrote it. So click the link below to download that for free. All right, so let's dive in to this topic today about confusing diabetes terms. And let me also say that the subterms for these have been changed a little bit over time, which makes it even more confusing. So type 1 diabetes, for example, used to be called juvenile onset, and type 2 was called adult onset diabetes, and they've dropped those terms because now we see people later in life developing type 1 or a version of type 1, and we see people early in life, unfortunately, like children, developing type 2 diabetes. There's also insulin resistance and metabolic syndrome, which I'll cover here as well. So first, type 1 diabetes is an autoimmune condition. About 5 to 10% of people with any form of diabetes have type 1, and type 1 is an autoimmune disease. So the immune system targets and attacks the insulin-producing cells of the pancreas called the beta cells, leading to their destruction, leading to an inability to make and release insulin, which leads to a total insulin deficiency and a dependence on exogenous insulin. Researchers by the names of Banting and Best actually discovered insulin in 1921. That's a little controversial, but at least they did the final work. And insulin was first made available in 1922 and is a life-saving medication for those who can't make it, including those with type 1 diabetes. Type 1 diabetes typically affects young people, children, and young adults. It's rapidly progressing, so usually the damage to the pancreas happens quickly and blood sugar goes up quickly. It's oftentimes diagnosed when children, especially, are really suffering, withering away, losing weight, weak, and other things are ruled out, and their doctor finally orders a blood sugar test, and oftentimes the blood sugar is very high. Because it's an autoimmune disease, we typically will see autoantibodies associated with type 1 diabetes, so these can be picked up in a blood test. There's 5 diabetes autoantibodies that are typically tested. GAD65, which is glutamic acid decarboxylase autoantibody 65. There's anti-pancreatic islet cell antibodies, there's IA2 antibodies, insulin autoantibodies, and the zinc transporter 8 autoantibody. The two most common that we do are the GAD65 and the anti-pancreatic islet cell antibodies. If either of these are positive, that indicates autoimmune disease, and if it's rapidly progressing in a child or young adult, we can assume it's type 1 diabetes. Now, there's another condition called LADA, which stands for latent autoimmune diabetes in adults. This is also autoimmune diabetes and oftentimes called type 1.5 diabetes. It's not type 1 and it's not type 2. It's a distinct form of diabetes. It's called LADA or LADA, and it's actually more similar to type 1. It is autoimmune diabetes. They will typically have autoantibodies like the GAD65 or the anti-pancreatic islet cell antibodies. The difference is it's much more slowly progressing and it typically affects adults. So we can see this in people in their 30s, 40s, 50s, or beyond, although typically it's in middle age. People with LADA are oftentimes misdiagnosed as having type 2 because they are older, but it is a totally different condition characterized by destruction of the beta cells. People with LADA may need insulin. They will probably need insulin at some point in their life, but many of them can go years without needing to use insulin by following a low-carb diet, exercising, and possibly using some oral medications. Then there's type 2 diabetes and the type 2 diabetes spectrum, which includes insulin resistance and metabolic syndrome, although metabolic syndrome is a bit different. Type 2 diabetes is characterized by insulin resistance. So the pancreas is making insulin. In fact, oftentimes it's making a lot of insulin, but the cells of the body, particularly the liver, the muscles, and the fat cells, are not properly responding to insulin. So the pancreas makes more insulin. We oftentimes see hyperinsulinemia or elevated insulin levels, hyperglycemia, which means elevated blood sugar, and then hyperlipidemia because we'll see elevated fat levels in the blood as well. Type 2 diabetes is diagnosed when the blood sugar reaches 126 milligrams per deciliter, fasting, or over 200 milligrams per deciliter on any spot test, or the hemoglobin A1C reaches 6.5% or greater. Before that, we call it either prediabetes, insulin resistance, or metabolic syndrome based on the presentation. So if the blood sugar is between 100 and 125, or the A1C is between 5.7 and 6.4%, that gets the tag of prediabetes. If it's less than that, but insulin levels are elevated, then it's insulin resistance and hyperinsulinemia. And if in addition to elevated blood sugar, you have elevated weight, a larger than normal waist circumference, elevated LDL cholesterol and or triglycerides, or suppressed HDL cholesterol and or high blood pressure or hypertension, in fact, if you have 3 or more of those, that is called metabolic syndrome. And of course, these 4 conditions, insulin resistance, prediabetes, metabolic syndrome, and type 2 diabetes, all really have the same root drivers, which is insulin resistance. Now, what about type 3 diabetes? Type 3 diabetes isn't actually a thing. It's been suggested as a term to represent Alzheimer's disease and its relationship to insulin resistance and an inability to properly metabolize glucose in the brain. So several researchers have noticed that people with insulin resistance have a much higher rate of Alzheimer's disease, and that glucose metabolism in the brain seems to be related to dementia, including Alzheimer's, vascular dementia, and other forms. There is certainly a strong connection or correlation, and some have drawn a possible causative connection between insulin resistance and Alzheimer's disease and other forms of dementia. So the term type 3 diabetes seems to fit, but the problem is you don't actually need high blood sugar to develop dementia, and they're not always connected. So I'm not a big fan of the term type 3 diabetes, but I do think it's important to look at the connection and improve metabolic health in order to reduce your risk for Alzheimer's disease and dementia. The last term I want to talk about is double diabetes. What in the world is double diabetes? I've seen a few people talk about someone with type 2 diabetes losing the ability to produce insulin or having a slowdown in insulin production over time and needing to be put on insulin, described as double diabetes. But that's not really what it is. That's not accurate. If someone has type 2 diabetes, insulin resistance that's led to chronic elevated blood sugar, and over time the production of insulin has slowed where we test fasting insulin and it's clinically low, in other words, under 2, that's not called double diabetes. It's called insulin deficient type 2 diabetes or insulin dependent type 2 diabetes. So what is double diabetes? Double diabetes happens the other way around. It's when someone with type 1 diabetes becomes insulin resistant and starts to exhibit a lot of the signs and symptoms of type 2 diabetes. So let's say someone's diagnosed at 6 years old with type 1 diabetes and they use lots of insulin over their lifetime and they gain a bunch of weight, become insulin resistant, develop metabolic syndrome, and start to show all the signs of type 2 diabetes as well as type 1. That's what's termed double diabetes. And sometimes those people are treated with insulin sensitizing agents like metformin, for example, or other medications, which can help reduce insulin resistance, perhaps help them lose some weight and become more insulin sensitive so they don't have to use as much exogenous or injected insulin. So I hope you found that helpful. You'll probably hear some of these terms bantered around. Now you know what they mean if you didn't know before, and hopefully that gives you a little bit of a better understanding about how complex this condition of diabetes really is. All right, this is Dr. Brian Mowll, the Diabetes Coach. Again, if you like this video, give it a thumbs up. If you disagree with anything I said here, leave a comment below. I'd love to hear your opinion. Or if you want to share your insights, again, leave a comment below. I'd love to read those and interact with you. If you have a question that you'd like me to answer in a future video, type that below this video as well. All right, that's it for this one. Thanks for watching, and I'll see you back on my next video.